back.
Thanks for these great presentations. It's really enjoyable. I just wanted to ask Joy a question about, I have a colleague who's done all sorts of work on opioid guidelines, but I don't see them by sex. Do you think a lot of those pharmacological guidelines should have some flag about that?
So when I said it's the idea about the important role of sex and gender is pretty well absent from the clinical interaction, it's also absent from almost every single clinical practice guideline I've ever looked at. So despite the fact that there's a huge gender difference in musculoskeletal disorders, and there's hundreds of clinical practice guidelines around treatment and assessment of of musculoskeletal disorders, I've never seen gender actually raised as an issue in any of them.
And just, if I could just add on to that, I mean, I think it actually occurs across a wide variety of disciplines as well. So I only recently became aware that if you're a female and you smoke, your risk of COPD is much higher than if you're a male and you smoke. Now, I was never aware of that. I've never seen a public health campaign message to say, don't smoke, and in particular, if you're a woman, did you understand that if you smoke, your risk of certain diseases is much higher than it is for men? Yet, that would appear to be reasonably relevant. So, I think there's probably a wide variety of areas where we need to know who is at the greatest risk for a given exposure.
Interesting, because I've analyzed our rotator cuff data, and I found exactly the same interaction with smoking and healing of a rotator cuff tendon after surgery. That more men have rotator cuff problems, more men have surgery, but smoking has more of an impact on women than it does in men in terms of.
I have a question for Joy, Dr. McDermott, with respect to the gender differences that have been recognized in her substantive area, particularly around response to pain. You had mentioned that there is some behavioral differences by gender. I'd be curious to hear a little bit more about that. Thank you.
So when we talk about gender role expectations around pain, I mean, there's certainly cultural, family issues, a lot of things that influence how acceptable it is to behave a certain way around pain, what the expectations of pain behavior are, how people express their pain. In three particular aspects of pain that are evaluated in terms of gender role expectations are: what's your sensitivity to pain, how likely you are to report pain, and your endurance to pain, and people's perceptions around those three, and that tends to be the focus in the literature, and there are some tools to measure those. So, for example, if you asked most people who would be more sensitive to pain, men or women, then women is a common answer. If you ask who has better endurance for pain, if you ask women, they say women, and if you ask men, they say men. And so, tolerance for pain, it's a little bit more around the map, but how there has been the way that people perceive those in terms of their expectations around pain for themselves and how much they identify with their gender role expectations. So it's what do you think the genders behave in terms of pain, and then how much do you identify with that has an influence on how people respond to pain. But then there's also an interaction then between clinicians and patients in terms of those gender role expectations. So if the expectation is, oh, women are more likely to demonstrate pain, but their pain is not as bad as a man who's then that can be the underlying reason why people are not offered surgery, drugs for the same amount of pain, because the perception is that you have to calibrate pain differently in men and women in terms of your observation. When they report their pain out of a 9 out of 10, is that different if you're a man or a woman? Those sort of things are all interpreted both on the person's end and also on the clinician's end.